The circumstances relating to the death of Jodian Ferron have brought into sharp focus the Health Ministry's protocols for the transfer of patients to and from health facilities. This follows controversy over the transfer of the pregnant mother from Andrews Memorial Hospital. Medical stakeholders are now calling for an overhaul of the system. But what exactly do the protocols say? Giovanni Dennis has more in this Primetime News follow-up.
This is the Policy and Procedure Manual for the Referral and Transfer of Patients, revised in 2016. Section 3.2, subsection X, says where bed space is a challenge at higher level receiving institution, A. All efforts must be made by the higher level institution to identify suitable bed space by discharging or transferring more stable patients to the referring institution or other nearby facility with the capacity to manage the less acutely ill patients. Subsection B further states, where highly specialized beds such as intensive care unit ICU or high dependency unit HDU are not available, the receiving institution and consultant should accept critically ill patients for intermediate care.
That guide in the policy and procedure manual about a type A hospital accepting the patient whether or not they have ICU space, we seldom have that happening if the patient really needs ICU care.
Dr. Alfred Dawes is a former senior medical officer at the Savannah Lamar Public Hospital. So what actually happens?
In reality, what happens is this. If you cannot get an ICU bed in a particular institution, you call around and try to get in other institutions. If that is not the case, the patient usually stays at the hospital where they're continued to be stabilized as much as possible until you try and get a bed or somewhere else to accept them. And this may take hours or even days.
But why aren't the transfer protocols always practiced?
The policies and protocols as they exist now are not practical in the real world as we practice medicine in Jamaica. The problems lie not only with the availability of resources, human resources and equipment in terms of stabilizing the patient and accompanying the patient to the accepting hospital, but also the availability of resources at the accepting hospitals.
According to President of the Jamaica Medical Doctors Association, JMDA, Dr. Elon Thompson, this shortage of resources starts with qualified personnel.
Availability of staff from the referring facilities. The referring facilities may also have their resource constraints, so they may have equipment-based resource constraints, they may have human resource constraints, and even the receiving facilities may have constraints with receiving a patient. Even though we are more equipped, we may not be adequately equipped to manage a patient we are receiving.
He argues that in many instances, patients are better off staying at the facility they are coming from because they will get better attention that the larger facility is simply not able to provide because it may be overcrowded, which is often the case. And so for Dr. Dawes, the current protocol needs to be revamped.
The whole transfer protocol needs to be re-examined, and not only do we need the input of the senior technocrats, but we ought to get the input from the junior doctors and the persons who are on the ground to see what their experiences are so that we can fix this thing once and for all instead of trying to make do with what we have and as our Jamaican saying is, turn your hand, make fashion.
The discussions, he reasons, should involve people on the ground who are experiencing the everyday reality of healthcare providers. But one thing is clear in the mind of Dr. Thompson, a policy that all Type A facilities should immediately implement.
But persons have to make sure that a critical care bed is available at all times in an institution, by all means necessary.
Giovanni Dennis, TVJ News.